51, we're still talking about illness. The illness with different conditions. So in the case of illness, and some illness perform warm. Some illness or some patients perform cold. That's one condition. Yeah, that's one condition. It's not criteria yet. Yeah. Some people or some patients like to see other people's. And some people's, they don't like to see anybody. Yeah. Like just inside the room and close the door and the window, don't want to see anyone. So that's a different patient with different conditions. Is anything relationship with脏腑 organs disorder by their symptoms? So that's the question here. So this page basically just make a questions. Yeah, just make a questions. Then let's see some explanation for the questions here. So for the illness, if like to cold, and also want to see the people. So now we put two conditions together. Yeah, we separate ask question. Now we put two conditions together. So the illness patient like to cold, like to drink cold water and perform cold environments, and also like to see the people. So that conditions will be in Fu organ. So that's pretty similar like we're talking about the 脏腑 organ disorder. Fu organ mainly is excessive condition. So that's Fu organs disorder. People more perform cold. And the Fu organ we say usually they cause the excessive heat condition. So they like cold and they like talk with others. We know some patient even coming to our clinic couldn't stop talk. Yeah, sometimes we take the intake form like use about an hour or even more because patient couldn't stop talk. That's generally say some heat condition. Yeah, heat condition, people continually talking. They like to see the people. They like to talking with the other peoples. So that's basically belong to Fu organs disorder. And if patient, they perform warm and don't like to see anybody, don't like to talking with anybody, that's basically is 脏 organ disorder. So that's why we say internal organ disorder. Most case kind of yang deficiency. Yang deficiency kind of patient, they perform warm. And also we say yang including qi. So Qi deficiency kind of patient, they don't want to talk. Yeah. They don't want to talking. They can talking, but they don't want to talking with other people because there are Qi deficiency. They even don't want to meeting with other people. Certainly, here is the condition with Yang deficiency condition, which is from one aspect to see the illness and the patients. Certainly, we have another condition, indifferency condition. People still hid there. They maybe still like to talking with others. But here, which is least, like we try to separate the 脏腑 organ disorder, we list the most conditionally in here. So that's generally say, people like a cold and like to meeting with other people. That's generally say is full organ disorder. And if patient perform warm and don't like to see other people's, that's generally say is 脏 organs disorder. So that's from another aspect. We talking about 脏腑 organ disorder. And then get some explanation here. Why? Yeah. Because 腑 organ is yang organ. So yang illness perform cold. And then they like to see the people. And the 脏 organ is yin. So yin illness, they perform warm. And then they don't want to communicate with other people. So they close the door and living by itself. They don't like to hear other people's voice even. So that's basically with this way, we try to identify 脏 organ and 腑 organs disorders. So that's basically in this chapter.